Singapore, more than 1 in 3 diabetes patients are not taking their medication regularly, a study has found. The study by the National Healthcare Group, NHG, found that 35% of patients diagnosed with diabetes between 2005 and 2010 did not commit to taking their medication. This increases the risk of hospitalization and means that patients have less control over their blood sugar levels, say doctors. This is a worrying figure that we need to change, said Dr. Sun Yan, Deputy Director of Medical Informatics at NHG. Still, the figure in the NHG study is lower than the global average. According to the World Health Organization, 1 in 2 recently diagnosed diabetes patients do not take their medication regularly. The NHG recruited 2,463 newly diagnosed patients between 2005 and 2010 for the study and monitored them for 5 years each. In the first 2 years of the study, researchers kept tabs on how faithfully a patient took his or her medication. Patients are considered adherent if they took 80% of the medication supplied. In following 3 years of the study, researchers monitored the health conditions of the patient. The study found that patients with poor adherence had a 0.4 increased level of HbA1c, the main indicator used to measure blood sugar levels. Males, Indians, and patients without other long-term medical conditions such as hypertension and dyslipidemia, were among those who fared the worst when it comes to taking their medication regularly. Mr. Gary Ang, Associate Consultant of Health Services and Outcomes Research at NHG, said, "Patients who suffer from these long-term conditions are often more educated on taking medications and perceive their risk as higher." As for why patients do not take their medicines regularly, researchers cited 3 key reasons: a lack of understanding about the medication, an avoidance of side effects, and cultural beliefs. Dr. Sandra Su, Senior Pharmacist at NHG Pharmacy, said cultural beliefs were hardest to tackle. It's a personal thing and we can explain to patients, but their understanding of Western medicines needs to be explored further. Mr. Ang added that debunking these misconceptions on medications and educating patients are the next steps.